So since I was on the panel, I wasn't able to check the score. Anything happened? Who won? Oh. They're still doing extra time? It's not in kicks? Okay. All right, so this last panel is the synergies between sectors. It's going to be moderated again by Kathleen. So take it away.
Thank you very much. Introduce my panelists here. We have James Geringer, who is the Senior Director with Environmental Systems Research Institute, also known as ESRI. And he was previously the two-term governor of one of my favorite states, Wyoming. It's a great place. And he's had an illustrious career spanning aerospace, STEM education, energy, environmental health, and he is a fellow committee member with me, so thank you for joining. We've got Daniel Greenbaum. He's the president of the Health Effects Institute, and they focus on providing information regarding the science of health effects, particular focus on air pollution, so very timely and relevant for our discussions today. Lynn, you've met already on the last panel, and Maureen as well. So as a reminder, Lynn's with Michael and Lori Milken. She's the dean of the Milken Institute School of Public Health there at George Washington University. And Maureen, of course, is Department of Economics chair at University of Maryland, among other things. So great discussions today. And it's our opportunity to pull out some threads that were in common, what we heard from the different groups and earlier discussions today. I just want to call out a few themes, and I'm going to turn it to you to add some color in what really struck you throughout the day. So many common themes from the different groups. I think shared enthusiasm for the initiative. First of all, just the science-based focus of it. Lots of folks commented on having this safe space, this arena for dialogue with very diverse constituents. People emphasized the need from the beginning to weave in diversity, equity, and inclusion throughout the process in terms of engagement and the study of implications of issues on populations. Solution orientation. I think what's interesting about this initiative is not only the interdisciplinary nature of it, but also this marrying of the science with practical application and drive to impact. Lots of conversation about scaling up mechanisms. You know, can we leverage existing work that's underway in pockets around the country, local levels and national levels? Can we leverage existing ecosystems and springboard from those? And so on. Good conversation about the complementary capabilities of different sectors, but also some of the tensions we might expect, and going in eyes open around different motivations and need to align those and find the common ground and work through that. And then going back to this point about implementation, I think some questions about, okay, so what are the mechanisms to do that? You know, if we look back at the track record, what's worked, what hasn't, and what new innovations do we need to bring to this undertaking to really get that link from the science to implementation? So those were some general themes that I was taking away listening to folks. Would love to just hear, what struck you. Maybe we'll start with you, Jim.
Okay. Let's see, I get one light or two. There you go. Now we go. Well, thank you. And it has been indeed a very interesting day and in some ways puzzling too. I come from a state of high altitudes, low multitudes, great attitudes. So y'all, we don't have Southern in Wyoming, but y'all come sometime. Part of the tasking of this panel is to say, what are some of the synergies? What are the things that would be mutually appealing to working across boundaries, sectors, disciplines, whatever it might be, but particularly within the national academies? I want to draw our attention back to the tasking to the steering committee was, how can the national academies of science, engineering, and medicine do more things together that cross their own typical boundaries? Or as our chairman said, don't stick to your own lane anymore. How can you drive comfortably. And having just come from Sicily, I can tell you what it's like if you just stick to the wrong lane. Those of you who have been there understand the Italian drivers. What I heard as much as anything today of a common interest, and I don't know if it's a synergy, it's a common interest. It's let's focus on solutions. Well, how do you achieve solutions? You must implement something to achieve a solution. We heard from NGOs. I serve on several nonprofit entity panels or boards, and there's a common thread among all of them. Where is the next source of funding going to come from? And many of their funders are saying, as Walmart and some of the other foundations indicated, well, if we give you this fund, this amount of money or this grant, what resulted? So my question to the national academies is, as a result of that last study, as a result of whatever study you pick, this happened. What is this? And what I heard more than ever today is implementation is lacking. Is that the tasking to the national academies, or is it something that needs to be passed on to someone else? Do the reports have to have a section to say, and here's where we think the tasking ought to go? Well, that would open up a whole dimension of debate, wouldn't it? But I heard that time and again today. There's a common interest in implementation. Setting priorities, yes, science-based. We know that the results are coming out that are well-based in science and evidence. In the world of decision makers, anecdote matters more than evidence, but let's give them the evidence in spite of that. So, for any of the grantees who would make funding available, because funding is the number one priority for doing any kind of a study within the national academies, can the academies say, because of this study, this happened? If there's more of that, there's going to be more funding. And I would say from the perspective of a person who's had to oversee a number of budgets, both in the private sector and the public sector, you always fund your highest priorities. That happens. How do those priorities rise to the top? How do those issues rise to the top within the academies? So I'd say implementation is the first area of common interest, and it has to be recognized as place-based, and place means where I am. Now, insert your name where the word I is. What matters most is what happens in my place. Now, who is my? How can that happen? And because that will aid in the setting of the priorities and what rises to the top. If I had an overall category to say where are the synergies, it's how do we anticipate? How do we spot the trends? How do we stay ahead of it? Rather than talking about how will this group respond to wicked problems, my answer would be is how do you avoid having a wicked problem? If we don't anticipate trends, if we don't have a mechanism to share what we view as these are the emerging things that are coming along in science, these are the things that are emerging with our surveillance systems, whatever they might be, is there a community of information exchange where we can spot the trends, anticipate the outcome, anticipate what we want to avoid? That's the whole issue of prevention in public health. The best solution to population health is to prevent things from happening in the first place. But if prevention is not available for whatever reason, early intervention is still, and mitigation, those are the things you do. I've been involved with a number of disaster situations, crisis responses, prevention, intervention or mitigation, response, and then recovery. Response and recovery dominate everything. Can we avoid having to go that far? Can we avoid that wicked problem? I'd say, how do we set up a process within the academies to where there's an opportunity to start to feed that, whatever we might call it, that the set of emerging trends that give us an indication of what might happen if we don't make some sort of an intervention. So that's where I would leave it for one of the efforts for the steering committee is how can we set up a process, whether it be health surveillance system or a cross-sector. I made mention of how cities are evolving to where anywhere from half to 2/3 of the world population over the next several years will live in cities. what are we doing to anticipate the problems that cities will have? Can we develop traffic systems or transportation systems that anticipate the impact of what we're doing in cities, how we are going to change our lifestyles, what's evolving that will help us make positive directions rather than just responding to negative directions? So I'd leave it with that, noticing the trends comment.
Sorry?
Croatia
It is.
Oh, excuse me.
I was torn on that
Okay.
one.
Now
I'm voting for both sides.
now there's a synergy.
So thank you. So yes, shared interest in driving to solutions, and how do we do that? And then how do we get ahead of the curve so we're actually preventing versus anticipating versus dealing with the backside of it? Okay, Daniel.
Sure, thanks. When I was first asked to do this, I was thinking, well, there's going to be this very diverse group of people here, different interests with industry and advocates and government officials, and the question, would there be any synergies? Would there be any places where they saw the same? And I actually found today one really large synergy, that all three of those groups wanted answers from science yesterday. They want it very fast. They want it as soon as they can turn it around. They want to be able, as Tom Burke said, to call up the 5 experts and get an answer on something really quickly. I didn't hear academia say they wanted to make the science happen faster. And there are...
Take it for granted, Dan. I'm sorry.
No, but there are good reasons for that. But I do think it actually poses an interesting both quandary and opportunity here. This is inevitable. As I run a research institute, and we're constantly, it's supposed to provide science to inform policy, and we're constantly under the gun and say, can't you give us an answer quickly on X answer or Y answer? And it actually potentially provides an opportunity for this initiative if one could identify, and several people have talked about this, some things to get going on out of the starting blocks where you could make where there's a body of science, where there's a synergy could be, a synthesis could be created using some of the newest techniques for that relatively quickly as a way of showing the potential for this. And I think that's clearly something that people will need to look at. I think there are a couple of challenges, significant challenges in that. One is the question of scientific quality, which the Academy stands for. The processes of peer review, getting things published and accepted, consensus reports. There's a reason for all of those things. But that will be a tension as you go forward, and it always is a tension. But the initiative is going to need to figure out how to manage that in a thoughtful way. I think that we should also recognize that speed, if not handled well, can also increase the conclusion that, well, we have a lot of uncertainties. If you don't have time for science to actually sit around a table, and some of us have sat there and say, yeah, there's a lot of uncertainties, but then you can probe it and you can discuss it, et cetera. And there will always be uncertainties, as we've pointed out, although Jennifer knows how to design studies, so that won't be the case. But how do you make sure that if you're going to try and meet that need for speed, that you don't exacerbate the uncertainties discussion unnecessarily in some ways. The good news is, and I thought Tracy mentioned some of this, there are tools that this initiative could use that are being tested. They were designed, the systematic review tools were designed more in the clinical sciences area. They are not necessarily directly applicable, as she pointed out, to environmental health because it's hard to have a randomized clinical trial for an exposure to lead, as some people that Hopkins learned a few years ago with some difficulty. Not to point out to any one group, but you can't do that. It's much harder to build that kind of science base. But the tools do exist, and they're getting stronger and stronger, and there are adaptations of them now, the grade tool and others that allow you to synthesize evidence systematically, but with some attention to what is necessary for environmental health as opposed to purely clinical health. I think one of the biggest challenges for this group is going to be working together, all of the people in this room, all of us, is to figure out, even as you get identified, and I have no doubt there are 2 or 3 things that could be moved on relatively quickly as proof of concept, maintaining some sense of the vision. Because the challenge, as I mentioned in the earlier breakout session that I was in, the challenge is that the academies have historically primarily done consensus studies in a somewhat opportunistic fashion when funding was available for a particular topic. Now, it's not universally that. I certainly participated in efforts to develop, to say, gee, wouldn't it be good if we did X or Y or Z, and then to develop support among the agencies or on the Hill or other places to have a more systematic look at a question. But it's going to be important for this initiative to come up with a vision, and the vision needs to be carefully crafted. If it's all encompassing and everything in environmental health, it's going to be hard for anybody to understand why is this valuable. So figuring out, are there two major themes, 3 major themes? Are there major areas that you would say over the next 5 years, we as an initiative would like to probe, this is what the environmental health implications are for the range of choices on transportation that we're facing going forward. So it's fairly practical, but could be very comprehensive. I had made the comment earlier to the group that you could do something like that built just around energy, not climate necessarily, although energy drives climate, but something that is a theme that's organized in some fashion so that it is not just the entire laundry list of environmental health questions. So I'm very optimistic. I think it's a great initiative. Kudos to those who got this underway. We're certainly at HEI looking for ways we can contribute in any way possible to this. But it's not without its challenges.
Thank you. Lynn, what do you see as the promise of this initiative in terms of that cross-sector collaboration and synergies?
Well, certainly manyfold. One thing I mentioned earlier that I just want to say again, and that is the importance of, in this environmental health arena, becoming more proactive. And if this slide had the tagline for the National Academies, which is advice to the nation, and advice to the nation certainly happens when called upon for advice about very specific things, but ought to also include going to the nation with what are the challenges that we see, coming forth. But I would also say that in my view, the academies have had a fundamental weakness that come about through the structure. And it was great to see Marcia McNutt and Dan Moat and Victor Zhao together at the table, all supporting this initiative. But, we have these 3 academies that are not only 3 different stovepipes, science, medicine, engineering, but within them are organized as sub-stovepipes, sections, and so forth that people belong to, right? And then we have the NASEM that has a multitude of divisions and boards. And environmental health is just, fragmented across all those areas. And most people don't even know, who participate in one or more of those are not aware of all the others of them. And I think that probably the committee has become painfully aware, along with the staff, just how complex that picture is, that it's a system that hasn't worked as a system. And I would say, that why is that a problem? Well, because, we are inherently tribal people, we are. And we work better, when we have some sense of shared experience, shared language, and we don't have that. And even in my own field, my department and my school, people who are in a single department of environmental health don't even really have that. They go to different scientific conferences. There are about 10 different professional societies that academics attend, and they don't meet together and again don't necessarily share common experience and language. And so perhaps I'm looking at a bigger, on a larger scale, whatever the issues are that are identified, that the opportunity to bring people together in a fairly safe place to do that, I think, will make a major difference for the field. A good thing about us, I will say, is that we don't have groupthink. We're skeptical. We are, we test things out. We're very critical. Maybe sometimes it means things take a little bit longer to do, but I think that we can do them very well because of that. But I think, on the other hand, sometimes we're guilty of splitting into competing tribes and throwing things at each other. And so that's not, particularly helpful in terms of, again, advancing that mission of advising the nation, and which I think, needs to be kind of fundamental to what this does. The mechanics around the different products, the academies have used all kinds of those. They've done short-term consensus studies. They've done letter studies. They've all kinds of experiments. And as a whole, the academies are trying to move forward to modernize their approaches in many ways to producing reports and products and communications. And this effort will benefit from that. But I think it's far more important for this effort to be focused on environmental health per se, the health of people, in our nation and on into the future, rather than being necessarily the place where every experiment is done for trying different mechanics and so forth. So,
okay. Thank you. Good. Maureen, bring us home. Last couple minutes.
Okay, well, I was going to give 3 very concrete examples of the kinds of synergies that I think this Environmental Health Matters initiative could lead to. Suppose we think about the health impacts of climate change, and we just think about the impacts of temperature extremes on mortality. If you go to the U.S. Global Change Research Program website, you can see the activities that various government agencies are engaging in with regard to this. You can look at the CDC, and you can look at the programs they're having to bring awareness to states and cities, but all in a very sort of top-down way. There's a huge amount of research going on in the epidemiological literature on the temperature effects of, the mortality effects of temperature. This is something that will be part of the next Global Burden of Disease report. And it's something that academics are actually drilling down and looking at very fine spatial detail at the impacts under different climate scenarios, bringing together climate scientists, epidemiologists, and economists to actually look at the level of counties at the impacts, the mortality impacts of temperature. The idea of bringing these groups together and having them talk under the Environmental Health Matters initiative is the sort of thing that I think this initiative can do. To give 2 other quick examples. So the issue of controlling particulate matter, Rich Fuller told you that this is still a continuing problem here in this country. And if you look at the way that this has been justified historically, it really has been by looking at, again, the mortality and morbidity impacts on chronic heart and lung disease. There is a huge literature looking at the impacts on children's brain of particulate exposure. There's a growing literature to tout to tout economists and their contributions, looking at the impacts of exposures to particulate matter on human capital formation, on school attendance, on subsequent earnings. There are huge benefits from these sorts of cross-sectoral discussions. And once again, because I see the red light flashing just very fast, people have talked about lead and the impacts of lead as though this is something that is really well known and well understood. And let's face it, as average blood lead levels go down, or the percentage of children with high blood levels go down, impacts at low levels really matter. And one of the issues that's come up throughout the panels today has actually been the issue of evaluating either programs like to actually counteract the effect of lead exposure when you don't have randomized controlled trials. And one thing, again, that I think economists have been very good at doing is to develop quasi-experimental methods to actually look at the impacts of these interventions, but also to go beyond just correlational studies and to look at the impacts of low-level lead exposures on children's test scores and other outcomes. So there's a huge scope, I think, for these kinds of interactions under this initiative, and so I think that the initiative has a lot to look forward to.
Thank you very much. I think with that, we'll bring this to a close. We really appreciate everybody being here. I think there are some final remarks, but thank you to the panel for all of your astute observations.